everyone. This is Claire. I'm so happy to have today Naomi. She's a special guest today. I actually met her when I was in a conference. It's called the Dental Speakers Institute. We happened to sit next to each other. She happened to know Dentaltoaster somehow, and we started to chat, and I loved her real honest story from being, an everyday dental hygienist who has the struggles that we all have. We talked about that a little bit, and now she's on a completely different journey to really take her career in a different direction. So I would love for all of us to listen and to learn from, Naomi, myself, and just really encourage our new grads to do better. So welcome, Naomi.
Thank you so much. It's great to be here.
Yes, where are you, Naomi, right now?
I'm in Clovis, New Mexico at my home, which reminds me I better turn off my phone.
Oh, it's okay. Don't worry about that. So Naomi's last name is Amador, Amador. And one fun fact about yourself, Naomi. Do you have something?
I'm a crazy Christmas lady.
Really
crazy Christmas lady.
How many trees you have?
I have 7 trees in my house. They are all actually still up. That's my goal today, is to get them all down. But yeah, I get extra crazy with Christmas. I actually do other people's homes as well. And I used to do it when I was in hygiene school. That was how I used to make money during Christmas break. And anyways, I've been doing Christmas trees for as long as I can remember. So I don't do as much now, but it was my cash money when I was in hygiene school.
Really? That's such an interesting fact. Who does Christmas tree as a side job to make some money in dental hygiene school? That is awesome. Okay. If I need help, someday I'm going to call you up. Thank you.
Here we go.
Perfect.
I'd love to.
So yes, one fun fact about Naomi. That's awesome. And then Naomi, so tell us when you graduated and where.
So I graduated in 2010 from Eastern New Mexico University in Roswell, and we actually graduated in December, so it was kind of a weird graduation time. So I didn't start practicing until the following summer because I didn't take my boards until March and April. So
okay, great. And that was 2010, you said, right?
So I started practicing in 2011.
Okay, so
I graduated in December.
So you've been practicing for about 10 years or so?
It'll be 9 this year.
Perfect. And the reason why I wanted to have this conversation with you is really to share the real story of being a dental hygienist and ask you, been 10 years, which is not like 30 years like some people have,
right.
But I'm sure you have some moments you have screwed up, you made mistakes, you wish you didn't have. Can you share some of those moments?
Oh man, yeah. I mean, it's funny. It's quite a journey from whenever you're first brand new out of school. You're so eager to change the world, and then it's so easy to fall into such a stagnant private practice everyday grind. And so that's kind of what I had fallen into. I worked for a practice that I started out with the practice brand new. The doctor had only been practicing for about a year or so, and his mom was his hygienist. I was his first real hygienist, and it was a really slow, brand new dental practice. And then we just grew and grew and grew, and so I got really busy cleaning teeth. It was really one of those things where you just get in the grind, and you sometimes forget and lose some of the passion that you had when you were first, out of hygiene school. And so that's kind of really where I was until one conference completely changed my life and set me on a whole new journey. But along that path, I just learned that you have so many ups and downs in your, your daily career of going from a really slow dental practice to all of a sudden being a very booming practice. And so as far as stories, basically you just learn to adapt for sure.
Okay, so you're saying the first office you went to, you said stagnant, so they didn't really see dentistry as something exciting. The whole team was not, that,
Well, not so much. I'm in the same practice, but we were brand new. And so we just sat around a lot. We did not have, we were in a very small town, a brand new practice. We didn't have a whole lot going on. And now here we are, almost 9 years later, to a very different, booming practice.
So you said you were the first hygienist, meaning you probably had a lot of responsibilities as well. Like you've seen it grow as well. You probably helped. Can you tell us a little bit more about that?
Yeah, so when I first started, the doctor did most of the prophies, and then his mom, she was a hygienist, had come out of
Mm-hmm.
retirement to kind of help him along. But I was really the first person to kind of help
Mm-hmm.
get it going.
Okay.
And so we went from basically having 1 to 2 patients a day. I mean,
Mm-hmm.
truly, I would be so happy if I had 3 patients in one day.
Really?
Yes, I
Mm-hmm.
mean, we're from a
Mm-hmm.
small town. And then to all of a sudden, word of mouth starts kind of getting around. And I feel like what I did with the practice is I really helped the practice grow by showing people that I cared about them.
I see.
Coming in, you get the nobody really loves the dentist speech, but I
Mm-hmm.
just feel like I was able to connect with people, and that's
Mm-hmm.
really, I think, what my strength is I connect with people
I see. I
and
see.
kind of help them get,
Mm-hmm.
just comfortable, and then you start building a relationship with them, and then before
Mm-hmm.
long, they're family.
Okay, so it seems like you really grew into the practice as well because you understood your strengths. You discovered that as you went along as well. Because as a new grad, honestly, I didn't know anything. Like I didn't know
Yeah.
what my strength, my weakness
You
was.
don't even know what you don't know.
Exactly. So it seems like you found your connection, the people that you serve, and that really propels you to continue forward. So I think one good lesson here already is like, guys, if you are out of school, it's been, let's say even 10 years, just understand what your strengths and weaknesses and kind of use that strength to propel you to feel motivated to go further and to really enjoy the profession, because sometimes honestly we feel like we're not enjoying it anymore, right? Do you have those moments too?
Yeah, you can definitely feel like you're just cleaning teeth all day, and
Yeah.
there's so much more that we're actually doing, but
Uh-huh.
it can be easy to get into a rut of
Huh.
day in day out cleaning teeth, propy perio, and you're just living your life,
Right.
kind of just on,
Mm-hmm.
um, what am I trying to say? What's the word? You're just like in a mode. You don't even think about it anymore.
Yeah. Well, luckily, well, not luckily, is because of your passion or your just awesome personality. Tell us about that time you went to the conference and really started to look for a different path as well.
Okay, so I've always been like a CE junkie, always,
Mm,
regardless. I'm always the person, like, I'll go to all the CEs. I'm in the front row every time. I just love to learn.
mm,
But, I never had really found something that just lit a fire under me and gave me so much
mhm,
passion. And one particular year, I was struggling with my own little girl. She was having
mhm,
these night terrors, and just
mm,
so happened I was reading in RDH magazine. I was reading the catalog for Under One Roof, and I saw a
mhm,
class about sleep. And I
mm,
remember thinking, I should go to that one because my little girl is, having some of these sleep issues, and
mhm,
I didn't really know anything about it. That was
mm,
not something that we were taught in school.
mm.
And so it just kind of got me thinking, okay, that's the class I want to take when I get there.
Yeah.
So I go and I'm sitting in this class,
Mhm,
and no joke, guys, this one class changed the course of my life.
mm,
This class was by Debbie Z. I don't know
mm,
if you know who Debbie Z is. I
mhm,
love her so much.
mhm.
It was called Dying in Your Sleep.
Yeah.
And in that one class, I had such a realization that
Mm,
my husband and my
mm,
daughter and my son, all
mm,
three had such significant signs and symptoms
mhm,
of sleep disordered breathing
mm,
that my wheels just started
mm,
turning, and I could not write fast enough. I couldn't get the information fast enough, and it just completely rocked me. I
mm,
mean, it hit me like a ton of bricks. And I knew right then, like, I'll never, ever practice dental hygiene the same,
mm,
because my eyes were open to a whole new world.
mhm,
And it was crazy because I'm like, I'm a hygienist. I love coming to CE. I'm not one of those people that had never attended a CE before, but I had never been introduced to this information of how vital we are as a hygienist
Yeah.
in being able to see the signs and symptoms and guide our patients. And so
Mhm,
that right there got me on a whole track of learning everything that I possibly could about sleep. So that's how it started. And then within the rest of the conference, there was other classes that, same thing, just were so vital. They hit
mhm.
me at just the right time
Okay.
and set me on a journey to be able to help my own family, but
Mhm,
also my patients, and then now teaching other hygienists and dental professionals about signs and symptoms to look for, because we're in the mouth longer than any other provider is in the mouth. So we have a very, very unique role.
Sure. Can you teach us something, please, about like
Sure.
sleep, how to find some signs and symptoms? I mean, we all practice dental hygiene. There might be something that we can do right now.
Yes. So, what you think about whenever you think of screening for sleep apnea, the kind of general thing we think of is obesity. While yes, that is definitely a sign and symptom and a risk factor, what I'm talking about are the things that we see within the oral cavity. So we are uniquely positioned because we have our patient laying back, so we can see the palate.
Right.
So we're going to be looking for things like a narrow vaulted palate.
Okay.
We
Like
can
that.
see, yeah. So, we're used to like kind of more of an ideal palate would be, you can't really see, like very U-shaped.
Okay.
And somebody that has more of a V-shaped or a vaulted palate,
Oh, so like
those are
that.
gonna, yes,
Okay.
more like this. And more V-shaped.
Okay.
So ideally, it's because your tongue, think about the shape of your tongue.
Yeah.
If your tongue was resting up in the roof of your mouth,
It rounds
that
it.
shape,
Okay.
very round like a horseshoe. If your tongue is not, if your tongue has rested down, you tend to take on more of that vaulted, V-shaped, narrow palate. So when you have a narrow palate, the floor of the mouth, the roof of the mouth is the floor of the nose.
Okay.
So you're going to have more of a higher chance of having nasal obstructions as well.
I see. Oh, it totally makes sense in my head because, I mean, our palate, we think like we're formed like that with one palate. There's actually two plates that come together when we are in our embryo. There are many different parts, that our face is actually literally like fusing here in our mouth anyhow. But that reminds me of that too. So it totally makes sense at an anatomical level why having a V shape is kind of telling you that there's something formation that can be related to sleeping, not just sleeping, but breathing in general and how your tongue rests. Okay.
Right.
Awesome. I
So
learned
that
something.
falls right into the breathing. We're looking right at the nasal breathing. So, when we see our patients before we ever lay them back, we can see the position of their mouth. And if somebody has more of an open mouth resting posture, then that's definitely another red flag that just, it's in our brain like, okay, this patient is having trouble breathing through their nose. So when we're looking at our patients before we've even laid them back, we're seeing about their breathing. We lay them back, we're looking for the narrow vaulted palate, and then we're going to be looking at tonsils. So tonsils are going to be on a scale between 1 and 4. 1 being the smallest, 4 being those kissing tonsils. And we've probably all seen those tonsils that you look in the mouth and you're like, wow, yes, all the way touching. So imagine that's your airway, that is your airway. So if somebody has really, really significantly large tonsils, then they most likely are having a significant problem or struggle to breathe. And so imagine when you're laying back and you have those huge tonsils and your mouth is open.
It's like
You've got the
blocking.
mouth, you've got the mouth open, and then your tongue is dropping back in your airway. And that's definitely a significant risk factor there.
Okay.
And then another thing we're looking for is scalloped edge tongues. If we
Okay.
see a scalloped edge tongue, there's a really high chance. There's think about your tongue doesn't have the space in the roof of the mouth to rest in the proper oral resting position.
Yeah, so
So now the tongue is down. So there's nowhere for it to go. So you're going to see those significant scallops on the edge of the tongue.
Great. Wow, I learned so much, Naomi. Just a few things: the tonsils, the tongue, see the palate, what it looks like. Now, that's why, as a hygienist, if we feel like we do a little bit more like that, I think it propels us to feel significant as well, to patients to see that we are significant as well, not just someone who cleans their teeth regularly. So it really changes their perception, our perception, how we feel as a healthcare professional. So Naomi, you have a website too, right?
I'm actually, my website is under construction right now, but it's almost up and running. It's going to be Smile with Myo. So give it a little bit and it'll be up and running.
All right. Smile with Myo, MYO, right?
MYO, yes.
Okay, perfect. Because Naomi is really on this track to be the specialist in this area, and I wanted to bring the story up. I knew it already because we met and we talked, but because sometimes again we feel stagnant, and there's something in dentistry that might resonate with you. For me, it was education. Like I just love education. A topic that I love is the brain. So brain, Alzheimer's disease, periodontal disease, I love that. Like that really just
It gets you
resonates with
fired up.
me. Yeah, so there might be something, and those can be found in continuing education courses because you have experts everywhere. That this doesn't have to be dental hygienists, it could be other dental professionals, it could be medical professionals, and you listen to them, you're like, I really want to go that path, right? So
Mhm.
Naomi, tell us about like the continuing education world. I get this question all the time from students or new grads saying, Claire, where do I continue my education? What are your suggestions?
So there's so many options out there now, and that's the thing. If you find something that you are particularly passionate about, then of course you want to stick to those specifics. But if you just don't even know what your passion is yet,
Yeah.
things like RDH, Under One Roof, and
Okay.
ADHA, the big national conferences, they really have a very variety of
Okay.
courses. Just like you said, a lot of oral systemic, lots of different
Mhm.
things. So just going out to your ADHA, your state dental hygiene meetings, and
Okay.
then Under One Roof is obviously really
Uh-huh.
changed my life. So
Okay.
I'm a big proponent of going to that one. And then once you get into something that you like, if you go online, there's so many resources, even like dental toasters.
Mhm.
You have a big variety of classes. So
Mhm.
online, and then of course the big
Mhm.
major conferences are definitely something that I would highly recommend to invest in yourself.
Okay.
Even if your doctor doesn't want to pay for it,
Mhm.
remember that you can invest in yourself, and it could completely change your life, just like
Okay.
mine.
All right, all right. I love this story because it really tells us that we don't have just one venue anymore. Because back in those days, I think there were a little less venues. I think there are more and more like smaller conferences as well that are happening in dentistry. Of course, the larger ones like RDH Under One Roof, ADHA are amazing, and that's where you meet tons
Mhm.
of people. But also, I mean, locally, there are so many that you can go. A lot of them are free as well. A lot of
Yes,
them are sponsored, so you don't have to pay anything or a small fee.
right,
So
right.
yeah, love the
Just
variety
get out there and
nowadays.
explore the CE world. You don't have to go to just the one
Hmm.
local one or the one that your doctor sends you to. I mean, there's
Right.
so much more out there.
Okay. Okay. So Naomi, if you had like three things or just a few advice that you would give to the new grad, if you look at yourself, 10 years ago, 9 years ago, what could you tell yourself?
Oh man, I would tell myself not to be so serious about it.
Okay.
I used to be
Mm,
so stuck on doing everything right all the time in my
oh,
brain that I at first had a difficult time managing, the just the appointment in general. You have
mm,
1 hour, how am I going to get all these things
right.
done? I used to have a very hard time with my time
Hmm.
management because a lot of us hygienists are very
Mm,
perfectionist
mm,
in
yeah,
nature, general. And so I would say, like, don't get yourself so worked up over every little thing,
I see.
because it's just
Mm,
you're gonna run into waiting for the doctor's exam or whatever the
mm,
case may be, and you can't get worked up over every little time management mishap in the beginning.
mm,
Now you'll
mm,
definitely get better, but it is really
mhm,
challenging at first to feel like
mm,
you want to get it all done, and eventually you will, but just
mhm,
make sure that you don't let it. I mean, I used to get stressed out
mm,
crazy over my time management, and
I see.
you know
So, for
but you
example,
definitely get better.
if you were not being able to complete like your priority assessment in one shot, within that 1 hour and do everything else you wanted, I mean that's what I felt too. I just I felt very stressed every single day. I mean now I
Mhm.
think maybe we have more experience, we're a lot more comfortable,
Sure.
but every day, yeah, I could see like I was doing this, and this wrong, and that gives us in the, like get us in the negativity loop. It's like
Right.
I'm not
Yeah.
coming from
So
profession.
concentrate more on what you've done right and what you've been
Okay.
able to accomplish more than like what you can't get
Mm,
done. You'll get better, but
mm,
definitely do not eat yourself alive, over all the things that you could have done better, should have done better, because you'll get there. You will do better next time,
Okay.
but it's really hard on your psyche, when you feel like all the things that you could have, should have done.
Mm, perfect. That's
And
one great advice that I would love
and
everybody to have as well. Is there anything else?
whenever you are first getting a job, make sure you get a contract. There's a
Mm-hmm.
lot of different things that can come about as a hygienist
Mm-hmm.
with your pay. So just be smart.
Mm-hmm.
Ask the right questions and get your goals addressed with the doctor. Make sure that you guys are on the same page, and then get it in writing. That would be something that I would really highly recommend, because
I see.
it can cause stress and strife later on if you're trying to backtrack and make those things. So just from the beginning, just
I
make
see.
sure that you are
Mm.
getting your
Mm-hmm.
getting a contract for sure.
Okay. So I agree with that. I started without a contract because, when you get a job, you get excited. They tell you you're going to get $35 an hour, whatever that is, you think that's it. But then, you have to protect yourself.
Yeah.
Now, your dentist didn't have a contract at that time. No. And when you started?
No.
No. Do you
Yeah.
have a
So
contract now?
I actually still do not.
Okay.
I do
Okay.
not. And see how
Mm,
steep of a struggle it is. Here I
mm,
am, this far in, and it's
mm,
really hard to kind of go back. So that's one
mm,
thing I would say.
mm,
I wish that I would have been smarter
mm,
in the beginning,
mm.
just to make sure that there's no changes later that can create
Right.
a concern that you'll have to discuss, because it's just better to have it done from
Mm.
the beginning for
And
sure.
especially money, I think. To me, money is always it's not an issue, but that's one thing that
It's hard
always
to talk
brings
about.
emotion,
Mm-hmm.
problems, fights.
Yeah.
So in the
Yes.
contract, for example, they should be how much hourly wage you would get if you are on production or something like that, how much you
Mm-hmm.
would get out of the production, maybe a contract date. This is valid from this date to this date, and then after that we can renegotiate, than rather putting yourself in an unlimited kind of contract, not be able to negotiate a better salary some other day.
Right. Right.
Is there something related to money or, something that you have seen you wish was on the, you had a contract with, anything you're struggling with?
So, there was a time where I was paid for a certain procedure, and then all
Mm,
of a sudden I was not paid for a
mm,
certain procedure. And then actually, randomly, I started getting paid for that procedure
mhm,
again. And so it caused a lot of
mm,
emotional turmoil for me,
mm,
because I really struggled with having a conversation about it.
mm, mhm,
And so, yes, so I mean, especially if you are making production and commission and things like that,
mm,
making sure you have the specific
mhm,
procedures, and
mm, mhm,
not just the amount
mhm.
of commission that you make, but the specific procedures that you'll be credited for,
I see.
um, versus not. Hmm.
Right. We can do, for example, a quadrant, and that's like, let's say, a certain percentage versus if you do a fluoride treatment, maybe you won't get commission. So be clear on what the office is willing to give or not.
Right. Hmm.
Okay. And just
Absolutely.
one more thing about, people think I love money. I mean, I mean, obviously it's like what propels us, to be here to provide for our
Right.
family, but I love the money talk because I hate when young grads struggle with that, with their loans, first of all, and not being able to be valued, because the value doesn't come just in the hugs and kisses. It also comes in how much the owner pays you. So, I want everybody to learn a lot more. So whenever I do a talk for the new grads, I always talk about money. But is there like a guideline or something that you can share with us, what worked well with you and you think is fair for our young grads to ask when it comes to certain procedures and percentages?
I honestly don't have a huge lot of experience with that, because I've
Mhm,
worked in the same practice my
mhm,
entire career. But
mhm,
based on just knowing what the going rate is for
mhm.
your area, and then knowing what you're worth and not backing down from that, it's very easy
Okay.
for hygienists to accept a lower wage because,
Mm,
like you said,
mm,
desperate. You have student loans, you have a
yeah,
family to feed,
yeah.
but also know you are a professional, and
Mm,
you deserve to
mm,
be compensated for your education. And so just make sure that you stand your ground and you know your value, and you go with the going rate, because it really can be such a challenge between different parts of the country. But there are lots of guidelines you can look online, like RDH magazine has something actually out right now talking about the pay between different areas of the country and whatnot. So just making sure that you know what your value is and not accept a lower wage just because you're desperate for a job. But I mean, I get it, I understand. I was brand new out of school as well at one point too. But just make sure, if you start so low, it's going to be really hard to get up to that value that you really are worth.
And also, you said you started with the dentist who didn't have much experience, and that also, is something, it's not so much an issue. I don't want to phrase it as an issue, but it's a learning process for everybody.
Yes,
As
it's a learning
having
process.
family members who are dentists as well, like you graduate school, I mean, you don't know anything about business. Like a contract is not something they taught you. Counting money, making your team feel valued. I mean, this is not something you learn in dental school. So when you get out, when the dentist doesn't know, I mean, just like you did, Naomi, it's a learning process together. I think it just comes down to having the right attitude. And maybe if you have an RDH magazine like that, or an article.
Sorry, somebody came to my door. My dog's
It's
going
okay.
crazy.
No problem. We all have pets. I used to have birds, but not
Okay.
anymore. So, they used to make their noise. But at night, I would cover them with the drape, so then they fall asleep, or not, they would wake me up all the time. But no worries.
Gotcha,
What
yeah.
I was
But
trying
going
to
back to what you said, yeah, definitely it is. He was brand new out of school too, and so was I. And we didn't know, neither one of us knew what we were doing. And so I think now, if we could go back, we definitely would have framed things out a little bit differently. Because again, when you're just starting out, you don't even know what you don't know. And so that plays another huge role. Are you joining a brand new practice? And again, just talking with other professionals in the field to make sure that you're getting what you're worth and that you're doing everything right by having a contract.
Okay. Again, I look at some of my family members, even my sister, my younger sister is a dentist, and at the beginning you don't know anything. And also the dental hygienist, I mean, we go to conference and we feel very confident and we know we provide a lot of value, but also there's an attitude, thing when sometimes we're like, we deserve this, and like push really hard versus trying to understand that the dentist is also trying to figure this out at the same time. So it needs to be more collaborative effort. And you suggested the article you can bring to the dentist's attention, saying this is an article and it kind of shows what the rate goes around this area. Would you consider kind of matching that, for example, like kind of provide evidence, provide other people's stories into the mix? So awesome.
Right. Absolutely.
Yeah.
Yes.
Well, to end before we end on we're gonna end on a positive note. So, Naomi, is there something you did awesome that you can share with us? It could be as simple as like, I did the most perfect prophylaxis for patient with braces or whatever that is.
No, I would say I'll think of one story. I had a patient come in and was very seeing signs and symptoms of sleep disordered breathing, and had an awkward conversation, because sometimes people don't want to hear that. They just came to get their teeth cleaned. But I had a particular conversation with somebody, and then a few months later she came back and said, hey, I just want to tell you that about a month later my husband said, hey, you were snoring quite a bit. And she said, you know what? My hygienist said I should talk to my doctor about that. And so she did, and she did end up having major concerns with her sleep. And she came back and she just gave me a huge hug and said, thank you so much, because I would not have listened to my husband if it was just my husband saying that. But since he had just recently talked to me about it, I decided, okay, I better go and have a conversation. And, it truly could save her life, because people with sleep apnea are at such higher risk for other comorbidities. And so that made me feel really good, and it, encourages you to keep on going and having those awkward conversations with people, even though sometimes they just want to get their teeth cleaned. But, we're more than just people that clean teeth. We definitely are there to help screen and just provide awareness so that the patient can
Uh-huh.
take advantage of your knowledge, and then maybe, they can go talk to their doctor and get something done about it. So that made
That's
me
an
feel really good.
awesome story because we talk about this, and that. We think they don't listen, but you know what? Somehow it gets in their back of their head.
Yes.
And when something happened, they're like, yes, I remember my hygienist saying that. You know,
Hmm.
so,
Yeah.
we feel like they're not listening to our education, but they actually are. I
Yeah,
love
because that day I definitely feel like she did not hear what I was saying,
Yeah.
and so it really was.
Mm,
It was very
mhm,
exciting when she came back and said, "You're
mhm,
right. I didn't really want to hear you that day, but
mm.
I'm so glad that you took the time to talk to me." So
Great.
I would
Wow.
definitely say just keep having those conversations, because
Mhm,
you might be the first and only person to talk to this patient about it,
mhm.
and so definitely just keep it up, even if
I
it's awkward
love
sometimes.
it. That's an awesome positive note. I love that we are ending with this. It encourages us to just do not more education, but keep doing a good amount of education so they can absorb it. And then it makes us feel good. It makes me feel good also as a hygienist, the things that you have done
Mhm.
and seeing you just really taking on this new role, in oral myofunctional therapy and also
Yes,
sleep and really helping
yes,
patients. So, Naomi, I can't
just
believe you
helping
went
create
like
awareness.
10 years, only 10 years you are, accomplishing all this. So I can't wait to see what the next 20 years will be for you.
Thank you
Mhm.
so much, and thanks
Yeah.
for having me on today.
Well, you gave us, especially our new grads, a lot of hope, a lot of great advice. And I'm looking forward to seeing you at Under One Roof at least this year, right?
Okay. Yes,
Uh-huh.
I will see you there for
Okay.
sure.
Thank you again, Naomi.
Thanks so much. Great talking to you.
Take
Bye.
care. Bye.